What's up, guys? Kate More Muscle. Today we're going to talk about head injuries. So, guys, this is a concussion is a traumatic injury to the brain that alters the brain functions. Guys, I've had some friends that go skiing a lot, and they have lots of head injuries because they fall a lot. So, what we want to do is we want to talk about what we can do, what the signs and symptoms are, and how to prevent those injuries, guys. Also, we can look at the football players. I don't I think football is a fun sport to watch, cool, but there are some serious people that come out with brain injuries, and when they're 50 or 60 years old, they can't remember anything because of that constant, hitting the head and that constant pain to the head. So, guys, we want to make sure that these head problems, these head injuries don't occur, guys. The head and the heart are the most important organs for the body because without it, you kind of can't do much. The brain sends signals to the body for it to move. The brain thinks. The brain stores its memories. That's all in the head. So it's really important to protect the head. So you want to wear helmets when you're skateboarding, motorcycling, or skiing, or playing contact sports. Wear seat belts, avoid dangerous activities, never shake a baby, install and use car seats, and obviously just be smart, guys. I never played football growing up, but continual concussions from football can lead to problems later on when you're 50 or 60, and I've seen it happen. We had a guy that came into rehab and I think, was about 50 years old. He was a college football player, and I can't say any names, but because that's against rules, you're not allowed to share patient's information. And this patient, when he was 50 or 60, I think he was around 60 years old, he started having memory loss. Couldn't remember what happened, and he blamed it on his football years. So, guys, repeated brain injuries is never good, and it's going to cause harm, maybe not tomorrow, but in the future. And it might, cut your brain off short. So, guys, let's get into it. Concussion is a traumatic brain injury that alters brain functions. Contusion is a bruising of the cerebral tissue. A laceration is a tearing of the cerebral tissue. Skull fractures are caused by direct trauma to the skull. Fractures of the skull can be linear, depressed, comminuted, basilar, open, or growing. Guys, some risk factors include lack of supervision, inappropriate or absent safety practices, improper use of safety devices like helmets or seatbelts. Some expected findings, guys, that includes dizziness, headache, diplopia. Guys, diplopia is where you see two things, and or vomiting. Amnesia, before or after the injury, alcohol, or ingestion of controlled substances, guys. So when you take alcohol, you're more at risk for doing dumb things. So that's why I never drink an alcohol, and I don't plan on it. Anyways, guys, amnesia, guys. I had a concussion when I was about 16 years old. I was playing some basketball and got hit onto the floor, and there was a wall behind me that was a brick wall, and I hit it. And my feeling is the rest of the practice, I just played through it, and it felt like a dream. It was really weird. It felt like a dream, and it just felt like everything was going so fast. It was really weird. And I got home, and I remember just turning on a TV show. It was like an hour show, and I remember it was dead in 10 seconds. And so it was amnesia, guys, loss of memory. I had that. I was dizzy. I had a headache. I did not vomit, but I felt like I was going to vomit. If it's really serious, you can lose your consciousness. You can have a minor injury, possible loss of consciousness, temporary period of confusion, vomiting, pallor, irritability, lethargy, drowsiness. You can have a progression of the injury. You can have, different changes in vital signs, altered mental status, neurological deficits, and increased agitation. Guys, these are all things that can happen when you get, the concussion, and you want to stay away from it. Now, guys, let's get more into it. So this talks about increased intracranial pressure, guys. This is very dangerous because when there's more pressure in the brain, that can cause edema in the brain, swelling, and it can cause problems in the brain. And you want it to be 1 to 10 is the expected range for ICP. Above 15 requires further assessment. So guys, above 15 is bad, 1 to 10 is normal. For like infants, you can see a bulging fontanelle, separation of the cranial sutures, irritability, restlessness, increased sleeping, high-pitched cry. In children, you can see nausea, headache, forceful vomiting, blurred vision, increased sleeping, inability to follow simple commands, decline in school performance, and seizures. And so guys, these are just some other things. You want to take an x-ray, you want to get imaging, an MRI, and you want to do a EEG, which is a electroencephalogram, to assess for seizure activity. So guys, these are all really important. Let's go to some medications. Mannitol. This is used to decrease intracranial pressure. So remember, if it's above 15, that's bad. That ICP, or intracranial pressure, if it's above 15, that is bad, and that can cause problems. So you want it under 15. You give mannitol if it's above 15. And this can be, decrease intracranial pressure and cerebral edema. So that's, brain swelling. Anti-epileptics, guys, this is to prevent seizures, because when you hit your head, you're at more risk for seizures. Antibiotics, in case there's a laceration or penetration into the head. Anytime there is that, you can get dirt, you can get germs, bacteria in there, and that can cause some serious problems. Next would be analgesics. This is for pain management. Morphine and midazolam can be given as well. So guys, we want to make sure that they don't have a spinal cord injury. You want to monitor vital signs, their level of consciousness. You want to use the Glasgow Coma Scale. Guys, this is basically indicating how serious their injury is. You want to keep the oxygen saturation greater than 95, and you want to maintain an airway. You want to use padded restraints who have agitation to prevent injury. You want to assess for clear drainage from ears or nose, and you want to report this to a provider. So guys, I've seen a lot of questions where it asks, after a brain injury, should you suction fluid coming out of ears or nose? That is a no, guys. You do not ever do that, because you want to test that if that's cerebral spinal fluid. You want to test that. Because if that is, then that's very serious, and you got to get a provider there and get surgery going or whatever it is. You want to assess for bleeding from ears. This can indicate a basal skull fracture. You want to elevate the bed to about like 30 degrees, so the bed should be going like this, and then 30 degrees up, kind of, just so that head can stay up. And you want to keep the body midline neutral position, so straight, kind of. To avoid any, flexion or extension. You want to minimize oral suctioning, and nasal suctioning is contraindicated, guys. That is because you want to test that. You want to avoid coughing and blowing the nose, because this can increase the ICP. That's intracranial pressure. You want to implement measures to prevent complications. You might even want to put a urinary catheter in to monitor eyes and nose. Administer a stool softener, because that's going to prevent ICP increase, because you're not going to have to push as hard. And you want to provide a calm and restful environment and minimize noise. It's very important. You want to monitor fluid and electrolytes and implement seizure precautions. provide adequate fluids, maintain client safety, provide nutritional support, maintain communication with family, and instruct family on effective ways to help with children, right? Anyways, guys, the next thing is you want to monitor for complications. That could be an epidural hematoma. That's bleeding between the dura and the skull. This could be manifest its way between short periods of unconsciousness followed by a normal period of for several hours, then lethargy or coma. You want to make sure they don't have a subdural hemorrhage. Some manifestations include irritability, vomiting, increased head circumference, lethargy, anemia, seizures, and coma. And you want to look for the complication of brain herniation. That's the downward shift of the brain tissue. And manifestations include loss of blinking, loss of gag reflex, pupils, Cushing's triad. So that would be hypertension, bradycardia, and respiratory distress, and a coma. Guys, whenever it says loss of gag reflex, that means you don't want to be giving them any food. They should not be eating or drinking because they have that chance of choking. So anyways, guys, this is head injuries, what to do, and how to best handle them. Anyways, guys, thanks for watching. Subscribe.